What will you do?
What will you do to expand Obamacare to provide health insurance for all Americans, and does that include expanding Medicare?
So this is important. We got to talk about healthcare here because we are on the verge of the most important pieces of Obamacare, the healthcare law, whatever you want to call it, from going into effect. In 2014, the most important parts of the law go into effect, which are this. Insurance companies will no longer be able to discriminate against people because of how sick they are. Individuals who can't afford insurance will get a subsidy scaled according to their income to help them buy private insurance. Businesses will also get help to buy insurance for their employees, and also individuals will be required to buy it because you now have access to that subsidy. There will be that individual mandate that goes into effect that requires people who can buy insurance to buy it. That will get to the point of the question, that will get insurance to about 95% of Americans. There will still be 5% of Americans who will choose, even with the subsidies, to not have insurance and pay the penalty. The penalty is actually very relatively small in the first year. It's less than $100 in that first year. Yeah, then it goes up. It does go up after that. But in the first year, it's relatively small. I think unless you're going to have a single payer system of healthcare where you just get healthcare as a unless you're going to have a system of guaranteed health insurance, as long as you're going to have a system like we do in which we sort of rely on a mix of private insurance and public insurance, you're not going to be able to get to 100%. I think 95% is a pretty good number to reach. The second part of the question is, will it involve an expansion of Medicare? I don't think it will. Listen, I would love to have everybody in this country be able to buy into Medicare if they want to. I think it should be everybody's choice as to whether they want to purchase a private plan or whether at their own cost they want to purchase into the government plan, because that would sort of test the idea that government health care is worse than private health care, because it would be up to individuals. And we could sort of have people sort of choose with their dollars as to whether they wanted care from Medicare or whether they wanted care from Blue Cross Blue Shield or Aetna or somebody else. At the very least, I'd love for people who are 55 and above to be able to buy in early to Medicare, because what we know is that we have a crisis right now of unemployment amongst those that are 50 and above. When you lose your job in this economy and you're a little bit older, we know that in part because of very unfair age discrimination, it's real hard to get back into the workforce. And those folks go without insurance and tend to have, more complicated health issues. And so at the very least, I think we should allow people who are 50 or 55 and older to join Medicare. But again, I just want to be honest, I don't think that law is going to pass. I think that we're just sort of going to implement the bill as is. And at least in 2014, those individuals who are 55 or 60 would be able, assuming they made under 400% of the poverty line, they would be able to get a reasonable subsidy to help them buy private insurance.